The TED stocking is a graded device. Graded meaning that the pressure applied at the furthest point or distal end of the limb is less than the compression provided towards the proximal or nearer towards the trunk. That way encouraging normal venous blood flow back from the distal part of the limb up towards the heart. You can see from this TED stocking that obviously when I talk about it being graded, you can see that the TED stocking comes in towards the ankle itself, trying to minimise the compression. At the top, this is a below knee TED stocking. The compression at the top here is very, very loose, though thus providing normal, natural venous return. With these stockings, we don't want more pressure up around the knee and less pressure down towards the ankle. This would then lead to the pooling of blood in the venous system and then would increase the risk of the development of a DVT. So when do we use these TED stockings? These TED stockings or compression stockings are often recommended post lower limb surgery. Each surgeon has their own specific recommendations of whether they prefer a below knee TED stocking or a thigh TED stocking. So it's important to understand the protocol of the surgeon and specifically understand which TED stocking they will be advising their patients to take home with them. One of the frustrating things with TED stockings is when they are ill-fitting. As a physio, I often will come around to the bedside and find that these stockings are inappropriately fitted. It's a difficult process to go through the fitting of a TED stocking, especially if it's been fitted down in theatre or in recovery when the patient may be still unconscious from the surgery itself. And I think if you're a nurse or a physio coming to assess your patient and you find that the stocking is totally inappropriate, it's important to go through the process of refitting the TED stocking. And the reason why this is so important is an ill-fitting stocking, where it's designed to minimise the development of a DVT or deep vein thrombosis, may in fact promote a DVT. And it's therefore vitally important that the stocking fits correctly. When measuring for a TED stocking, there will be certain things that you require to effectively measure for the appropriate size TED stockings. First of all, you'll need a one-use only measuring tape. These measuring tapes are found in the cupboard where the stock for the TED stockings are. I usually recommend that you also grab yourself a pen so that when you're measuring the circumferences and the lengths of the patient's limb, that you're able to record down those measurements. This can be useful when you then go to refer to the measuring chart, which is also found in the cupboard where the TED stockings are found. And that way you're able to match your measurements to the chart and therefore pick the correct stocking. It's an important resource for you to make sure you pick the correct stocking. It will run through the fitting and the correct measurements for a knee length stocking and also the correct measurements for a thigh length stocking. To measure up the below knee TED stocking, there are two measurements that you require. The first is the circumference of the calf, and this is taken at the largest measured area. The second measurement is the length of the lower limb. This is taken from the heel to the middle of the knee. The first measurement we take is the circumference of the calf. Usually I would get the patient to slightly bend their knee. I would then apply the tape around the widest part of the calf muscle. Bring the tape around so we then get an accurate measure of 35 centimetres. The second measure is from the heel to what we call the popliteal fold or the middle of the knee. Bottom of the heel to the middle of the knee, and we can see in this case 47 centimetres. When fitting the thigh TED stocking, there are three measurements that are important. The calf measurement, the length of the limb, in this case it is taken from the heel all the way to the gluteal fold, and also the circumference of the upper thigh. This circumference is once again taken from the gluteal fold. Once fitted your TED stockings, it's important to go through a final check. As you can see here, the TED stocking has a fold in it, and we need to make sure that there are no folds in the TED stocking. A fold increases the pressure, and by increasing the pressure, in effect, it's minimising the movement of fluid out of the lower part, or the distal part of the limb. In this case, it will require a little bit of manoeuvring to just slowly make sure that this fold is now out of the stocking. It's a below knee TED stocking, so once again check that the upper part of the stocking is located just below the knee and a fraction higher than the calf. So once you've removed all of the folds out of the stocking, then just assess that the heel is in the correct position. You may find there'll be a little bit of excess TED stocking towards the end. We obviously don't measure the foot size. In this case, the stocking can either stay loose, or I can potentially roll the stocking back past the toes. Obviously the risk of developing a DVT down your toes is incredibly small, and also you're providing more compression distally anyway, so this is quite satisfactory to just slightly fold over the TED stocking if need be. The most critical thing is that the heel position is correct and that there are no folds within the TED stocking, and that the TED is sitting just below the knee. So when you're fitting the TED stocking, it's important to tell the patient what you're doing and why you're doing it. In this way, when they're at home, they will apply this TED stocking correctly. So go through the process that it should sit just below the knee. Make sure they understand that there are no folds within the TED stocking. Get them to understand the position of the heel, and if there is excess at the end of the stocking, how they can manage this. So when fitting a thigh TED stockings, there are things to consider here. Obviously there will be a foot section, a tapered knee section, as this is a graded device, and the thigh section. The gusset here is found on the inside, or you apply it onto the inside of the thigh, and there is a non-slip upper section which will obviously help to try and keep the stocking in place when the patient becomes more mobile. Applying the stocking, again, make sure that there are no folds. Make sure that it is running up right up to the gluteal fold. This is where we took our thigh measurement. As you run down, check that the lower part is fitted to the ankle and to the heel. If we have excess stocking at the end of the foot, again, this excess stocking can be left just loose, or once again, it can be folded down gently so that it doesn't become a slip and fall hazard. Always instruct the patient about what you're doing. It's important that they understand that there are no folds within the actual TED stocking. It's important for them to understand where the heel section will be and what to do if there's any excess stocking at the end of the TED. Once you've fitted the thigh TED stocking, a final check is useful. If you feel that the shape of the thigh or the body shape of the patient is not allowing that TED stockings to stay in position, and hence it's beginning to roll down or consistently rolls down, it may be required that a decision is made to go to a below knee TED stocking.